Hello everyone, this is Dr. Moedda, and today I will talk about the incidentaloma. As the name suggests, it's an asymptomatic mass on the adrenal cortex. It can be either benign or malignant. This mass can be functional, which means it can secrete hormones, or silent. Incidentaloma will be discovered when patient is doing some testing and imaging like MRI and CT scanning. The incident rate is 2% in the population and it's increased to 10% in the elderly. In order to know if this mass is benign or malignant, it's recommended to do a CT scanning and to measure the density of this lesion. If you are still uncertain, you can do PET scanning or MRI. These are the radiological features of malignancy. The mass is more likely to be malignant if it's more than 40 millimeters and higher than 10 units of density. Positive uptake of glucose in PET scanning is also suspicious of malignancy. This is an algorithm of the investigations for the adrenal masses. If the mass is showing high suspicion of malignancy, we should think of local invasion. If the mass is locally invasive, we should do an open adrenalectomy. If it's not invasive but it's less than 6 cm, laparoscopic adrenalectomy is the best. If the mass is not invasive but it's more than 6 cm, we should do a surgical approach. On the other side, if the mass is not showing radiological features of malignancy, we should see if it's functioning or not. If the mass is less than 40 millimeters, it's benign, it's not functioning. This will not require surgery, but the patient should undergo a follow-up after 6 months. So here is a sum up. If the mass is locally invasive, go ahead for surgery. If it's not functioning, no surgery. If it's functioning or it's small in size and not invasive, we should go for a laparoscopy. So as you can tell, when there is a high suspicion of malignancy, adrenalectomy is recommended. Adrenalectomy is cutting and removing the adrenal gland which is functioning and making an excess hormones. Note that we don't do any biopsy here, as any stimulation of the adrenal gland will result in a high blood pressure causing sudden death. Luckily, more than 80% of these masses are non-functioning and benign.